specialty. However, I have really enjoyed learning a lot about this to talk about this topic a little bit more with you and some of the evidence that exists for using complementary and integrative medicine with our older individuals that we're working with. So I have no relevant financial interests or other relationships with manufacturers of any commercial products or providers that are discussed in this activity to disclose. And I do have some objectives for us. And these objectives are pretty high level, pretty straightforward, I think, but I'm hopeful that by the time we're done with our conversation today, that you'll have a better understanding overall of complementary, alternative, and integrative medicine, that you'll identify some examples of physical, psychological, and nutritional complementary medicine approaches, that you'll describe complementary medicine use in older individuals. And I see that the slide deck is in the chat for everyone too. That you'll identify some guiding principles for dietary supplement use. And then we can begin to explore some of evidence-based examples of complementary and integrative medicine use in older individuals. This is such a wide topic to begin a conversation on. So one of the first things that I wanted us to do was just to really be able to have some common definitions that we're using as we begin to have this conversation. So the first definition is conventional medicine. And so just as a reminder of things that would be conventional medicine, those might be things that would include medication or radiation therapy or surgery. So things that would be pretty standard treatments for a number of disease states at this point. Some other examples of conventional medicine that are included in a whole health proposal or whole health recommendation we'll talk about a little bit later include things like getting your eyes checked and getting your teeth checked and having those regular routine screenings as well. So then complementary and alternative medicine is something that maybe you've heard of, and I had heard of this, and this is something that I think a lot of people are familiar with the terms, but maybe not as familiar with the definitions. So alternative medicine is used as a replacement for conventional medicine, whereas complementary medicine is used along with conventional medicine. And then the best description of integrative medicine or integrative health that I was able to find talked about being intentional to use conventional medicine with complementary medicine. And when that happens, when it's coordinated and you're using complementary medicine that has evidence to support its use for a given disease state, and you're using that alongside conventional medicine, that is when integrative medicine or integrative health is occurring. So interestingly, the National Academies of Sciences, Engineering, and Medicine did publish a guide for whole health in 2023, and they defined whole health as physical, and this is a quote directly from their introduction, whole health is a physical, behavioral, spiritual, and socioeconomic well-being as defined by individuals, families, and communities. Whole health care is an interprofessional team-based approach anchored in trusted relationships to promote well-being, prevent disease, and restore health. It aligns with a person's life mission, aspirations, and purpose. It shifts the focus from a reactive disease-oriented medical care system to one that prioritizes disease prevention, health, and well-being. It changes the health conversation from what's wrong with you to what matters to you. And for those of you who have been with our GWEP for a period of time, you'll recognize that what matters question as one of the 4 M's. And so interestingly enough, this document or this guide was intended to be used with veterans in the VA medical system, but they also said that it is an approach that could be looked at across the nation. And I think this is an example of trying to make integrative health more the norm versus the exception. So here's a moment for some audience participation, and I am going to pull up our screen again so you can be involved here. In the chat, and I'm hoping that you'll be able to see this as you go, I would like you just to type first, and we're not going to hit enter until everybody has typed. And when everyone has typed, we'll hit enter at that point, and they'll kind of stream in and you can see everyone's responses. So take a minute to write as many examples of complementary medicine that you can think of in a chat response, but don't hit enter quite yet. And when I say submit, enter your response and we will watch and read them all cascade in through the chat. So I'm going to give you just a moment to type into the chat individually what examples you have that you know already of complementary medicine. All right. So let's hit enter now and let's see them all come streaming in. And so I see a lot of people typing a lot of things, and perhaps you're reading as you go. I actually was able to do this as part of a conference, and I found it to be really interesting just to see everybody's thoughts streaming in like this. So perhaps you'll be able to use that again in another setting. But as you can see, there were a lot of different topics, and some of these topics are things that we'll talk about today, and some of them are things that will be beyond the scope of this discussion. So it is very challenging to gather information on all of the topics. And what you'll find is that there is not a lot of evidence yet for a lot of things, but we are learning more about the effectiveness and the benefits of a variety of different complementary medicine applications. Okay. So complementary medicine includes physical, oops, I'm going to go back one more. Complementary medicine includes physical, psychological, and nutritional approaches. And in addition to that, there are approaches that combine these. So you might have a psychological and a nutritional approach like mindful eating, or you might have a physical and a psychological approach like things that focus on mind and body together. So I thought that this was a really great illustration, and this is from the National Center for Complementary and Integrative Health. And I'm going to refer to them quite a bit as we talk today. They have a lot of really good resources that are available, but this is an illustration that they use to decide or to demonstrate all of the different nutritional, psychological, and physical types of complementary medicine and where those overlaps occur. And so on this list, you can see a number of the things you've talked about, you have indicated in the chat already. So you can see on the left, we start off on the bottom of the green for drugs. There are botanical drugs and dietary supplements. Under nutritional, dietary supplements and vitamins and minerals come into play. And these are some of the things that people most commonly think of when they think of complementary medicine. So those dietary supplements, vitamins, and minerals. But you see that nutritional contains a lot of other things. And as we move into psychological, we see mindfulness and spiritual practices, psychotherapy, meditation, breathing and relaxation techniques, art, music, dance, yoga. Tai Chi is kind of overlapping with those physical aspects as well as movement education. We see acupuncture in here, light, electrical, and magnetic stimulation. And then we also see physical manipulations like chiropractic, heat and cold. And we see food being used as medicine and diet and dietary patterns. So there's so many things that are included in complementary medicine. So in order to help us really start our discussion today, I wanted to talk about a few articles that provide some insight into how older individuals are using and reporting their complementary medication use. Now, in general, older individuals tend to be underrepresented in clinical trials. And so I think that that is likely true for these topics as well. Some of the articles are not necessarily direct measures. They're using data that was collected for another purpose, so secondary data to look at information that people had, or it's administering a survey to another group of individuals. Okay. So these are the three articles that we're going to spend a little bit of time on today. So the first article is Dietary Supplement and Complementary and Alternative Medicine Use Among Older Adults in Australia and the United States. And so this trial actually is a cross-sectional analysis of 15,729 older adults from Australia and the US that were enrolled in the ESPRI trial. And the ESPRI trial was aspirin and reducing events in the elderly. So they administered a survey that had some questions about supplements or complementary and alternative medicine use over the previous month, they administered that to the participants during the last study visit of the ESPRI trial. And so interestingly, this study really narrowly limited or narrowly identified what supplement and complementary and alternative use was. Alternative medicine use. So it really included things like vitamin D and calcium and fish oil. And so it was primarily supplements or vitamins that were being used. And it didn't ask about anything else like Tai Chi or yoga use or visiting a chiropractor, anything else that would maybe also be complementary medicine. So you can see the definitions of complementary medicine are also something that haven't been consistent in trials. So the mean age was 79.6 years, and most of the respondents, 88.8%, were from Australia. So these are helpful for looking at older individuals, but our population in the US may not exactly equal the population that is in Australia. And the participants were relatively healthy. So they were expected to live at least 5 years. They didn't have cardiovascular disease, dementia, or any significant physical disability. So the results were that 66.2% of participants used one or more supplement or complementary and alternative medicine. And you can see some of the examples of things that were included. So vitamin D, fish oil, calcium, glucosamine, and multivitamin were used in decreasing percentages from 33.8% of participants to 12.9% of participants. So vitamin D was 33.8% and the multivitamin was 12.9%. And I found that this quote was very interesting. Female sex, U.S. residency, higher education, polypharmacy, using prescription medications, and frailty in women were significantly associated with higher use of supplements or complementary and alternative medicines. So what are the takeaways? Well, one of the things that they had on that survey was a spot to identify other. And so older adults are definitely using complementary medicine, but over 25% of the respondents reported taking something other or doing something other than the product that was listed in the survey itself. And so I do think that some of the intro information they included in this trial as they were explaining the importance of this is helpful for us to think about as health professionals. So certainly I'll quote this article again, but using supplements and this complementary medicine among older adults is associated with potential risks and benefits. So that's right from the study. And I think some of the things that they talked about are certainly thinking about drug interactions, adding additional potentially unnecessary medications or supplements or herbs to a regimen could potentially cause increased adherence issues, could increase burden of taking pills or supplements, and it can also increase the cost. So those are all things that they identified in this quote, you can see. And so, again, thinking about how do we safely recommend agents for individuals to use, we're just beginning to start getting some of this information, but understanding that people are using it is the first step, and us being able to identify what they're using and how that might interact with what they're taking and what they value and the rationale behind using some of these are going to be very important for helping us to understand what matters most to our patients. The next one was disclosure of complementary and alternative medicine use among older adults, and this was a cross-sectional study. And this was actually an anonymous survey. This was completed in the United States, and it was primarily focused on a pool of patients from Connecticut that were associated with the University of Connecticut Center on Aging Research Volunteer Registry, or were otherwise some other way affiliated with the university. And they did it over the course of almost a year, where they looked at providing these survey questions. And what they did, which was interesting, was they had a 22-question survey that included complementary and alternative medicine use. And then they tried to identify factors that were associated with whether patients chose to disclose that information to their primary care provider. They also asked questions about patient health and overall patient trust of their primary care provider. So they asked really based on 4 broad categories. So they asked about herbal product and dietary supplement use. They asked about body work. So this would be something like massage or going to the chiropractor. They asked about mind-body practices, which would be like meditation or yoga or Tai Chi. And then they asked about naturopathy, acupuncture, and homeopathy. And so if a patient answered yes to using one or more of the categories I have listed there, they were then asked if they disclosed that information to their primary care provider. So what they found, 60.1% used at least one type of complementary or alternative medicine in the previous year, and 64.4% disclosed one or more types. So the most commonly used was herbal products and dietary supplements, and that was followed by mind-body practices. So interestingly enough, the quote that I have next from this article that I thought was really impactful, I want to just focus on that last sentence. So the top 2 reasons, and this is again directly from this article, for non-disclosure among participants in the non-disclosure group were: number 1, never thinking to tell one's primary care provider, and number 2, the primary care provider never asked. So I think that gives us, again, some takeaways. During our patient care encounters, being more intentional to ask about complementary and alternative medication use or medicine use is critical, and establishing trust with providers helps to improve patient-provider communication. And so I think that that is just really impactful. If we're only asking about whether patients are using herbs or dietary supplements, we're not really capturing the full picture of the types of complementary medicine that they may be using at this point. It appears that patients are normally using these, so the more we can normalize talking with patients about their use, the better our care will be. And finally, the last article that I wanted to talk a little bit about was the use of complementary and alternative medicine among older adults. And this would be differences between baby boomers and pre-boomers. So this was a secondary analysis of data that was collected from the collaborative psychiatric epidemiology surveys to differentiate between those born in 1945 and earlier, or those born between 1946 and 1964, the baby boomers. And so this article was published in 2017. So I did stop to do some math to help us better understand what patient populations were being looked at here. And in 2024, this year, the baby boomers are between 60 and 78 years old. And so although this was published in 2017, the data for this study or these surveys were actually gathered in 2001 to 2003. So pre-boomers were already older adults, but the baby boomers themselves, when they were answering questions for this study, were actually middle-aged. They were between 35 and 55 when the survey was completed. And so data that we see from them, we maybe wouldn't expect their opinions or thoughts or use of complementary medicine to have changed. Perhaps they have remained the same or increased. And that might mean that as these individuals are starting to get older, as the baby boomers are starting to get older, then maybe our healthcare approach to taking care of these patients may need to change too. And that was one of the takeaways from this article. So they did end up with 11,371 participants that included adults born 1964 or earlier. This group had one of the most diverse, or had a more diverse inclusion than previous studies, although it still wasn't representative of the general population. They did at least have other minorities and groups that were identified that were not just Caucasian in this group. And so they studied this in the context of mental health and mental health disorders. So respondents were given a list of commonly used alternative therapies and were asked, did you use any of these therapies in the past 12 months for problems with your emotions or nerves or use of alcohol or drugs? The list of therapies included, and this is the quote directly from the article, included acupuncture, biofeedback, chiropractic, energy healing, exercise or movement, herbal therapy, high-dose megavitamins, homeopath, hypnotism, guided imagery, massage, prayer or other spiritual practices, relaxation or meditation techniques, special diets, spiritual healing by others, or any other non-traditional remedy or therapy. So this study actually had the most wide definition of what they considered to be complementary medicine that they were asking patients about. Just to give us some context, I did look at the National Center for Health Statistics for anxiety, and we can see that as the years have progressed, so again, this study was done in 2019, but patients were asked many years ahead of that. We can see that for all age groups, the incidence of, or the percentage of patients who regularly had feelings of worry, nervousness, or anxiety has increased. So the results. So 23% of adults use complementary and alternative medicine for mental health, although not all were older adults in this study. So there were 27.7% of baby boomers who, if you remember, were middle-aged at the time of the survey that were using complementary medicine, and there were 16.4% of pre-boomers, or the older adults at the time of the survey, that were using it. So one of the takeaways was just recognizing that patterns of use of complementary medicine may depend in part on generational differences, and whereas in the last 20 years, we may not have seen as many older adults using complementary medicine, we might expect that that would change in the future. So audience participation, I'll let you either type in the chat or chime in. Take a minute to reflect on what you've learned versus what you see in your practice. Does it surprise you how many older individuals may be using complementary medicine? And I'm just going to open the chat. And I see that we had a comment, more is not always better with supplements, and toxic doses. And
I've had the same question related to doses. Have you seen people taking supplements without consideration of the dose? Is that common? And the comments suggest, I think that's common. Because I've noticed a lot of these supplements, they don't go through FDA approval because they are supplements, right?
Right. So I'm actually going to talk a little bit about that as we go through here in the next section, but you're absolutely right. So these medications or these herbal supplements or dietary supplements are not approved by the FDA. They're not regulated for safety or for even accuracy of ingredients. There are a lot of things that you have to do to be an educated consumer, and products can differ from one product to another. So we will definitely talk about that.
Thank you.
Mm-hmm. All right. So we're going to kind of come back to this. Conventional medicine and complementary medicine is integrative medicine or integrative health. And that's kind of where we want to head. And we want to use evidence-based medicine whenever we can. And really, that's the highest standard, right? Using evidence-based medicine to guide our recommendations for integrative health. Conventional medicine is already guided by evidence-based medicine. We see clinical practice guidelines that are based on the highest level of randomized controlled trials and recommendations that are made in that respect. But complementary medicine often does not have the same level or extent of evidence. I will say that from my research that I saw in preparing for this presentation, that it does appear that research in this area is increasing. And there have been some recommendations that do have a more substantial body of literature to draw from, but many do not yet have a substantial body of literature. And so where our patients are getting their information may not always be an accurate or helpful source. And a lot of it is likely based upon antidotes and anecdotal recommendations, for example. So keeping that in mind, there are general principles that can be applied, especially when we think about evidence of safety or harm or efficacy that is not always available or the information is limited. And so it really is important for us to be talking with our patients and finding out exactly what it is that they're using and making sure that they understand that just because something is natural or is available over the counter without a prescription, that it is not necessarily safe, and it may not be safe in the dose that they're taking or in combination with the other medications that they're taking. So rather than talk about specific evidence for dietary supplements today, because I know a lot of people have a lot of interest in a lot of different dietary supplements, I thought I would talk about just guiding principles for safely approaching using those with patients so that they have an understanding. There are some really great handouts, and these are available for anyone to download and distribute. They are not copyrighted. These are published by the FDA to help inform consumers. So there's two of them that we're going to talk about today. One of them is Dietary Supplements, a consumer handout, and the other is Dietary Supplements, a guide for patients talking to healthcare professionals. And so both of these would be great resources for patients. I think that one of the things that was brought up is how are dietary supplements regulated, and you can see that in the left-hand picture. It talks about the FDA, and I'll read this as a quote. The FDA does not have the authority to approve dietary supplements or their labeling before they're sold to the public. And how are they labeled? They are required to have a supplement facts label that lists serving size, the number of servings per container, each dietary ingredient in the product, and the amount of certain ingredients per serving. They are also required to have a statement on the front identifying it as a dietary supplement or similar item. So the second page talks about the risks. Are there any risks in taking dietary supplements? And it does highlight in bold here, be alert to the possibility of a bad reaction or side effects, also known as an adverse effect. And that can occur if you take too much of some supplements. And I believe someone mentioned that already in the chat. Or if you're combining supplements, supplements and medications can have herb or drug supplement interactions and can make them have increased adverse effects or decrease the effectiveness of the medication that it's being taken with. And sometimes people will take supplements instead of evidence-based medicine without understanding the difference between the two and the risks that are involved in maybe potentially not adequately treating disease. So there is information. How can you be an informed consumer? Always talking to your healthcare professional, doctor, nurse, registered dietitian, or pharmacist before purchasing or taking any supplement. And I think, if there's any message you wanted to get out to your patients, it would be, don't start using a dietary supplement until you've at least had your doctor or pharmacist check to make sure it's safe to use for you. Not necessarily that we don't ever want anyone to use dietary supplements, because I think that's pretty unlikely to happen, right? I mean, there are things that people will want to use to supplement their health and supplement their diet, but we do want to be sure that they're using them in the safest manner possible. So on this second one of the things it talked about is on the left-hand side, you'll see be an informed consumer. On the right-hand side, you can see speak with your healthcare team, and then what questions to ask your healthcare professional. These are really great questions, and this would be something really great to talk to patients about. Is taking a dietary supplement important for my overall health? Am I taking the right product? Am I taking the right amount? Is there an amount or an upper limit I should not go above? How long should I take it? Are there any known side effects? Are there any foods, medicines, prescription or over-the-counter or other dietary supplements I should avoid when taking the product? And if I'm scheduled for surgery or lab work, are there any supplements I should avoid? So I really like these questions, and this is a handout that I think would be helpful as well. It gives a few examples of how dietary supplements can interact with some medications, and this is certainly not all inclusive, but this was last updated in May 2022. The nice thing about using a document like this to provide patient education is it's often updated by the FDA, and so you can continue to look back for updated documents to share with patients. Any questions about general approaches to dietary supplement use? All right. So let's talk about some examples then of evidence-based complementary and integrative medication use. So these are some examples where we already see, I think, a trend toward integrative medicine versus just traditional medicine or what has been traditional medicine in the past. So the first one is the Mediterranean dietary approaches to stop hypertension and Mediterranean/dash intervention for neurodegenerative delay MIND diets. So this would be the Mediterranean, the DASH diet, and the MIND diet then that we're talking about are associated with less cognitive decline and a lower risk of Alzheimer's disease, a review. And so I just wanted to talk a little bit about this study. So we already know that the Mediterranean diet and the DASH diet have been used to decrease a patient's risk for cardiovascular disease. So those are already dietary approaches that we recommend to patients that are part of a clinical practice guideline. And so that would be kind of that interface of nutrition and disease as well. And so in this study, they looked at each of these diets and they looked at kind of what was there. And overall, all of these diets are basically plant-based diets. They limit red meat and sweets. They all have nuts, beans, fruits, vegetables, and it seems like olive oil is a key component across all of these. What they did find was that patients who use the Mediterranean DASH or MIND diets did have less cognitive decline and a lower risk of Alzheimer's disease, but they were not able to tell if there was any change for dementia. And the strongest evidence seemed to be for the MIND diet, which was a combination of the Mediterranean diet and the DASH diet. So overall, they need more studies, though, on the evidence for the MIND diet. But this is one example of how we could see implementing dietary changes along with a number of disease states to help improve a patient's health and to kind of focus on their overall health versus just treating a disease with a medication or with surgery or another more conventional method. Some of the other examples they talked about were mind and body practices, and this was actually from the NCCIH Clinical Digest for Health Professionals, and this is a digest that you can actually subscribe to, and they'll send you an email every week or every month. I can't recall off the top of my head which one, but this one was published in August of 2019, and they gave information on what the science says for mind and body practices for older adults. And so they started off with osteoarthritis, and for osteoarthritis, in this article, they were talking about older practice guidelines, but since then, there have been updated practice guidelines for osteoarthritis, and actually, for osteoarthritis, it is recommended, Tai Chi is recommended to be used for patients who have osteoarthritis in their hips and knees. And so that's an example. Yoga is conditionally recommended in the same guideline for knee osteoarthritis, but it does not have as much evidence as Tai Chi. And acupuncture is also something that they looked at for most of these, and there was not high quality evidence for acupuncture. And so they felt the efficacy of that was controversial for osteoarthritis. For menopausal symptoms, they looked at mindfulness as being helpful, yoga, meditation, and Tai Chi. For sleep problems, they talk about relaxation therapy in the insomnia guidelines, but they don't recommend that it is the only therapy used to treat insomnia. They recommend using relaxation therapy as one of the components of cognitive behavioral therapy for individuals with insomnia. So that has a higher level of evidence than using it just independently. And then for shingles, Tai Chi was recommended, or something that seemed reasonable. For balancing risk of falls, for balance and risk of falls, I should say, Tai Chi and exercise programs have been shown effective. And for cognitive decline, they talked about both Tai Chi and yoga. So those were some examples in that area. So again, this is from 2019. It is possible that there is more evidence that's updated for these, or that recommendations will become stronger. And for some of these other ones, they did list some other items, but they had a little less evidence. What they're mainly trying to do is go through literature now, it looks like, and try to do systematic reviews to see if the evidence that is available can provide some insight into what might be most helpful. And then the last one that I wanted to talk a little bit about today was a randomized controlled trial of Tai Chi for health education for geriatric depression. And so this one was published in 2022, and they looked at providing an intervention of Tai Chi over a 12-week period versus health education and wellness training over the same time period for patients who were stable on an antidepressant. And so for these patients, they did not have concomitant anxiety, they only had depression, and they measured their depression scores, and they made sure that they had been on their antidepressant for 4 months before they were randomized to the trial. So there were 178 patients who were enrolled, and both interventions improved depression. And so they did look at this health education and wellness training as a active control. So it would kind of control for the idea that maybe people were feeling better because they were part of a group, or they were getting attention or support in that way. And so that was one of the ways they tried to control for that with the Tai Chi, so they could look at both of them together. So both interventions improved depression, but the Tai Chi had a greater impact, not only on depression, but also on general health. And so the other thing that they talked about was over a period of time, they measured them at 3 months. So that would have been at the end of the intervention, and then at 6 months, so 3 months after the fact. And they found that the Tai Chi numbers dropped slightly at the 6-month period. And they did wonder if perhaps that would have been different had they persisted in Tai Chi versus doing the intervention and then waiting 6 months to see if it was still effective at that time. So that was the trial that I thought was interesting for us to think about as well.